Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Lisa Herbert. She's a family physician and a certified executive leadership coach. Today's Kevin MD article is From Burnout to Breakthrough, How a Coaching Culture Transforms Healthcare. Lisa, welcome to the show.
Thank you so much, Kevin, for having me. I'm excited to be here.
All right, so let's briefly share your story and then talk about what led you to write this Kevin MD article.
Yeah, so I'll try to be brief, but my story goes back to, growing up as a little girl in Brooklyn, New York. And that's where my roots started, and that's where my actual interest in medicine started as well. Coming from a community where there was not many physicians in my area, but there was one who was actually a great mentor as well as a family physician who served in my community for about as long as I can remember, who encouraged me to, go to medical school. And when I went to medical school, I obviously chose family medicine
Mhm.
just because of, you know, the experience that I had growing up in that environment and also from having him as a mentor. He served as a family physician for my entire family, myself, my mom, and my grandmother. So I saw myself in that role, doing that thing as well. So I went on to medical school, chose family medicine as my career
Mhm.
choice. And then when I first got out of residency, my first job was actually as a medical director, which is sort of unheard of, getting a leadership role
Mhm.
right out of residency rather. So it was a great experience, but there was a lot that I had to learn. And there was a lot that I realized that I didn't know or didn't receive in my training, going through medical school and going through residency, all those leadership skills that we tend to
Yeah.
talk about now. So fast forward, having spent 7 years in that organization, doing some really great things as a medical director, I really wanted to get back to my roots of being a family physician. And I took over a retired physician's practice and practiced medicine for about 22 years, which is a
Wow.
long time in
Yeah.
private practice. Right, right. So, back then, EHRs were probably just starting,
Mhm.
to develop. So, insurance companies, HMOs, all those things were really just starting to develop. So, I was sort of in the thick of it, in the throes of, this change that was happening. And, about 15 or so years into my practice, I went through burnout, which is what a lot of physicians, even 20 years later, are still going through.
Mhm.
So going through that burnout process, was really a struggle. I had a friend who was not in healthcare who recommended that I get a coach to help me sort of figure out what my next steps were and to sort of work through some of the obstacles that I was facing. And it transformed my life. It
Mhm.
was the best decision that I had, ever made. And that sort of began my, transition into coaching and my coaching career.
All right. So I've been practicing primary care similar to you. Like I'm in my 23rd year now doing internal medicine primary care. And I can't imagine a private practice family physician doing primary care. Very difficult in this day and age. And we've both certainly seen the evolution, right, of primary care through all the
Absolutely.
different changes. So when you said that you felt burnt out after 20 plus years, exactly what were you feeling? What did that feel like?
Yeah, so it was this exhaustion that I
Mhm.
couldn't really explain. And it wasn't really resolved with rest or with going on vacation, or taking a break from medicine. It was not really that physical, but like a mental, a draining sort of exhaustion. I was, pulling away from things that I loved, sometimes becoming a little cynical, even
Mhm.
like, oh, well, I guess this is just how things are, right? Losing a little bit of, that optimism of sort of the things that we are looking forward to when it comes to being in primary care and taking care of patients. And this sort of just doing this daily grind of feeling like I had to work harder to make things better.
Mhm.
So those were some of the early, I think, signs that I had,
Okay.
definitely.
So you mentioned how coaching really was a turning point in terms of your burnout, and you talk a little bit about that in your Kevin MD article, From
Yes.
Burnout to Breakthrough, How a Coaching Culture Transforms Healthcare. For those who didn't get a chance to read your article, tell us what it's about.
Yeah, so I share a little bit about my own experience with coaching and sort of again just how it transformed, my life and my career and why I decided actually to then decide to go into coaching and to
Mhm.
sort of take it on to help my colleagues and to help my, fellow physicians in terms of helping them to deal with things, challenges and the burnout and all the things that we have to go through in medicine. And what I realized is that, I was doing this sort of, one-on-one coaching, getting really good results with a lot of my colleagues. They were benefiting from the coaching, sometimes going into organizations, doing that one-on-one coaching. But what was really missing was the organization actually adopting what I call a coaching culture, right?
Mhm.
Where everybody sort of takes on the mindset of if I can coach someone, whether that's a person on my team or whether that's my colleague, or whether that's just someone in a different department, think about how we can transform the entire system and maybe not just do it as a, sort of a one-on-one transactional almost service. So that was the whole, impetus behind my article was to sort of get healthcare organizations to understand that we need to move past sort of the traditional, methods that we were using in the past and maybe what we would consider professional development to help physicians and to really take it on as a culture so we can create this, psychological safety that's necessary to help people sustain within organizations, but also just to help improve patient outcomes and to help hopefully reduce the amount of physicians and healthcare professionals that are leaving medicine.
In your article, you cite that 54% of physicians report burnout symptoms, and the majority of physicians practice in employed settings. And a lot of times, like you said, they don't have that culture of coaching. So, what specific things needs to happen in order for that culture of coaching to take place? What would that look like?
Yeah, so I think healthcare organizations, first of all, need to understand what coaching is and what it actually does, right? There are still a lot of, unfortunately, organizations that use coaching sometimes as a performative measure, right? So someone's having a hard time, they're not doing well, let's bring in a coach and try to fix it. Whereas coaching really should be used as something to help an individual to improve upon the skills that they have almost as a preventive, to
Mm.
start off in the beginning, not when someone's really having problems or having issues, right? So it's to help to bring together teams, it's to help develop maybe early career leaders that are taking on leadership roles, maybe to help someone who's transitioning into a different, role within the organization. So it's not so much to use it as a performative, measure, but it's to use it again just to help grow an entire organization and to help to grow individuals and to help teams to work together more collaboratively. So I think it's one organization's understanding what coaching is and how to use it. And then it's also making sure that those who are in leadership roles understand what it means to be a leader and that coaching is a skill that they should have in order to be able to help, again, their team to do the best job that they can.
Now, is the coaching that you're talking about, is that different from, say, mentorship?
Absolutely. Coaching is much different from mentorship. A mentor typically is someone who maybe is someone that you look up to that
Mhm.
is on the career path that you would like to have. So you may go to that person and ask questions about what it's like to be in that position or what steps did they take to sort of get to that position. Whereas a coach is really going to do a deep dive into what are some of the skills that's needed for that position and how can I help you to develop those skills, that may be helpful for you along the way.
So, how do institutions, a lot of them are under time and financial pressure, what are some of the first steps they should take to implement the coaching culture that you're talking about?
Yeah, so that's a great question. I think first and foremost, they can certainly, bring someone in who has the credentials, who might be a coach, certified coach, who has worked within the healthcare industry, because I do think that that is important for someone to understand, the industry and sort of all the intricacies of healthcare. They can start by just bringing someone in to introduce to the organization what coaching is, what it
Mhm.
looks like, what are some of the conversations that we can have on a day-to-day basis with our team members and use that coaching, mindset to help us to be able to communicate better. So you can just start off with, bringing someone in to help teams understand how to communicate better. That's one way that an organization could bring someone in, certainly to help, or at least to start.
Now, can you tell us a success story where an organization implemented what you're talking about, perhaps bring a coach in and really made an appreciable difference before and after?
Yeah, absolutely. So there was an organization that was actually, I would say, acquiring, right, practices, which happens all the time.
Hmm.
So there was an organization that was acquiring some practices, and there was just one particular practice that was doing very well, but needed to sort of understand what this new culture was, right,
Okay.
of the organization in which they were now becoming a part of. So I was brought in as a coach, basically, to help coach this new practice around right? Adopting some of the vision and the mission of the new organization that they were going to become a part of. So part of that meant that, I had to really coach the new, the new practice around what it meant to now collaborate,
Hmm.
right? And to work together with, other people within that organization. But then it also meant helping the organization understand what acquiring this practice was going to look like and what some of the challenges were going to be, and that it wasn't going to be just an easy, turnkey sort of situation, that there needed to be a lot of communication on both sides, that there needed to be some skill development of this, new medical director who was going to be a part of the larger organization, that there needed to be some continuing communication between all the team members. So once we sort of established what that was going to look like and what that coaching journey looked like, at the end, after about 6 to 12 months of being with that organization, it was really a positive thing for both sides because the organization was able to successfully acquire that particular practice. The practice now was able to hire more people. It expanded. They moved to another location. So it just really worked out to be best for both sides. But had they not had that sort of intervention, I will call it, or at least that bringing together of the minds, I don't know that it would have gone that smoothly.
And I want to emphasize one point. Like you said, that this is a process. You were with this organization for 6 to 12 months, and I assume that you met with them regularly. And this just reiterates that coaching just isn't a one-time thing, right?
It is not a one-time thing. Absolutely. I would say that a people always ask, well, how long should a coaching relationship be? The minimum, if especially if it's one-on-one, is 3 months.
Mm.
Ideal sweet spot is 6 months, but sometimes it does take a year. It can take 12 months. And then I always say that after 12 months, it doesn't mean that it ends even then. There's always things that come up sometimes, after that relationship ends. So I think it's always important for coaches to have internal coaches, but also have those external coaches that they can call on anytime, there needs to be a reset.
And in your article, you talk about a ripple effect of coaching beyond burnout, and sometimes it could have downstream effects like improving interactions with patients. Tell us more about that.
Yeah, absolutely. So, I don't know. I guess we all kind of in medical school went through sort of, this training around how to have conversations, right, with patients. And I think it's evolved now to understanding that it's a partnership,
Hmm.
right? When you're dealing with patients, you want to make sure that, you're giving obviously, good care and you're giving good recommendations, but the patient also has to buy into what you're saying. So, teaching, I think, physicians and teaching healthcare providers how to have those conversations, even on a coaching level, meaning that you are actively listening, that you're asking the right questions, right? That you're not assuming, that you're leaving space, for the patients to kind of just speak and
Hmm.
for you to actually hear them, definitely has downstream effects because patients are more engaged, the trust factor goes up, and 9 times out of 10, they'll follow your directions more when you're approaching it from that sort of conversational standpoint.
So, what's the current landscape like? Do you feel like a lot of healthcare executives and leaders of organizations today, are they seeing the value of coaching that you're articulating today?
I think they are. I really do. I think they are. I think it's still slow. I think
Hmm.
it's slower than other than other industries, who obviously have documented what the ROI is. If you look at other industries, finance, tech, and all those, they have really done the research and have really documented that there's a significant ROI from coaching. I don't know that you can find those statistics in healthcare anywhere yet, but when you're talking to executives, I think they do understand and they are seeing that return on investment.
So, how about those physicians who were like you before you went into your coaching journey? If they wanted to implement some coaching tactics, some coaching techniques into their practice, where can they learn more about that?
Yeah. So I mean, they can obviously reach out to me. I've held several workshops over the past couple of months around that topic in and of itself, which is coaching conversations, how to have those conversations with your team members, how to influence your team members. So they can certainly, reach out to me for those. They can also just reach out to any organization, that offers coaching and hopefully they'll be able to offer those same services to them as well. But I think it's important for them to, if they don't have, a coaching resource within their organization, that they speak up and ask for it because I think it's important. It's going to help them to, hopefully develop professionally, but also to help with their patients as well.
So, taking a step back, you mentioned that you were a primary care physician for 20 plus years and you transitioned and incorporated some coaching, and now you're helping organizations implement some of these practices. So, tell us about that professional transition and what it was like for you.
Yeah, wow. So we're talking, probably about 10, 15 years ago now. But I think that what initially, what I would like to say first and foremost is that I think we go into medicine sometimes thinking that it's linear,
Yeah.
right? That there's this straight path that, we have to just check the boxes and we do the one thing and that's it. So for me, I had to learn later, much later on in my career, that it doesn't have to be linear, that we
Yeah.
can have, different obviously passions and different things that we like that we can incorporate, into our careers. So for me, after having a coach, I think that is what opened my eyes to actually thinking about coaching as a career. So being exposed to a coach, knowing how much it had transformed, again, my life and my career, and then taking that small step to sort of just get a little peek of what that was like. So I took a weekend intensive course around coaching and what that was like and learned about, how much it could help,
Hmm.
my colleagues and really felt passionate about the work, doing some research and finding out again how much it was just impacting the lives of so many people. So after doing that weekend course, I decided to just go full throttle and get my certification as a coach, which took about 6 months. So, I enrolled in a school that afforded me to have the ICF certification.
Hmm.
So I went forward with that, for like I said, for about 6 months. And then after that, decided that I wanted to eventually transition, my career into offering coaching, initially to just my colleagues. So at first I kind of did it as a side gig,
Hmm.
a lot of us have these side jobs sometimes that we do. And for a lot of us, it's just to fulfill again, that purpose and that passion. So I started off, initially just doing it sort of as a side gig, and
Hmm.
then eventually it just grew.
Yeah.
I think that the need was there, and as the need grew, then I needed to obviously devote more time to it. And it was just an easy transition to be able to sort of, do that over time. It wasn't something I just, again, did overnight, but it took, maybe at least 2 or 3 years to sort of build up the coaching practice into something now that I do for the most part, full time.
We're talking to Lisa Herbert. She's a family physician and certified executive leadership coach. Today's Kevin MD article is From Burnout to Breakthrough: How a Coaching Culture Transforms Healthcare. Lisa, let's have some take home messages that you would like to leave with the Kevin MD audience.
Yeah, so one of the take-home messages is one I think which I already mentioned is that I would love, for all my colleagues to remember that medicine is not linear.
Hmm.
So, you know, think about anything that you're passionate about, anything that maybe just sort of just brings that spark into your life. And I think that that's one of the ways that we can help combat burnout, right? If we just sort of adopt the things that really sort of bring us joy. So medicine is not linear is one of the things that I like to sort of leave with you all and understand that there may be some bumps and bruises along the way. There may be some curves and bends in your career, but anything, I think that is worth having in the end, comes with those turns and those twists. So that's one thing I would definitely like to leave. And then the second is I always like to, tell my clients that there's always two sides to a story,
Hmm.
right? And I think that that's helpful when we are sometimes in situations where we're dealing with conflict, which we do which we are, typically a lot. There's always two sides to a story. So don't go into a conflict with your boxing gloves on, be open, make sure that you are practicing active listening, that you're listening to the other side of the story, and then you can sort of come to a conclusion and make your decision, after that.
Lisa, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you for having me.